All right, welcome to DBC Diaries, episode 25. I'm here with returning patient Roger. Hello, Roger. How you doing?
Pretty good. Yeah, pretty good.
Great. Glad to see you here again. So I think this is your third trip here?
Fourth
Jeez,
trip here.
Getting there. Okay, great. So it's been a few years, done a few different things. We just did your knees today.
Yes, they're done.
How did it all start? What got you here originally?
Originally, probably back in the middle of 2021, my knee started to go downhill really quickly. Went to the doctor in July, and I go to the chiropractor every month. So I talked to my chiropractor, and he said, "You know what? I know a guy that went down somewhere and got stem cells. I'll see if I can get a hold of him and see how he made out." So he did, and he said, "Yeah, his knees have been good ever since." But I don't think his knees were as bad as mine. And I got to slow down and take it easy on my body a little bit more to make it last longer. But it's so far so good. Like, I'm happy with the results that I've been getting, because when I was wearing these big long knee braces before I came down here the first time.
Yeah.
And I left them, I put them back in the box.
That's awesome.
Yeah, put them back in the box. And this is still almost going on the fourth year now, right?
Yeah.
Third.
Amazing.
So far so good.
All right. So get the knees better. And you've done the IV with us also. And what did you notice with that? Anything?
That's interesting, because I was thinking, okay, maybe my IV was running out when my knee started feeling bad.
Oh, okay.
Or not this time.
Yeah.
When my knee started feeling bad this time. Okay, so is my IV gone, or is it just the knees are going downhill again? But no, it was the IV. I think it kind of perked me up for quite a while. Yeah. I got to the point between the IV and the injections in my knees that there was no pain. I was back to normal again.
Oh, that's huge.
It was for me.
Man, so in your case, and this is why we always do MRIs, I mean, we actually haven't seen major change as far as the knees. It's been minimal there, but it's gotten rid of the inflammation, because I remember the first MRIs, it was just, your knee was huge. There were tons of inflammation, all of that. So we've been gotten it at bay, and now we're working on regenerating the cartilage, getting things back to where they should be. It does, we wish everyone was one and done, but when it's as bad as, where you were at or other people, it can take more than one treatment. That's just the reality of it. Stem cells are awesome, but they're not magic. We always let people know that. And if you're willing to take the time, do the effort and do it, you can. But I mean, you've got big company you're running around. So, it's tough to stay off the knees in those cases when you're working all the time, right?
I don't have the time to sit and get new knees and spend 6 months sitting down. And
yeah, that's a great point too.
I don't have the time for that right now.
I think people don't think about the downtime you have to take if you go get those surgeries and what it means to, it hits every aspect of your life. So
exactly. So
that's always been our goal, is to try to help people avoid surgery if we can. I mean, there's cases where we can't, but we do our best to filter that out, let people know if we can help or not, and take it from there. So, no, thanks so much. Thanks for coming again. Thanks for sharing. And if you'd like to learn more about mesenchymal stem cells, please get a hold of us. You can go to the website at www.dreambody.clinic. Scroll down. You'll see the knee treatments listed on the front page with all the other treatments. You can click. Information's there, prices, all of it. And you can call us toll free at 833-445-9089. I'm Josh. Happy to help.